Hi, my name is Catherine, and this is my Spanish 101 Connections project. I had the opportunity to volunteer with the Craven County Health Department Primary Care Services and shadowed the Spanish interpreters for a day. It was about an 8-hour day. With that, got to interact with a lot of different people that are from various different Spanish-speaking nations, and they actually had me conducting a patient satisfaction survey for the clinic so that the clinic can work on improving their services for their Spanish-speaking population. So it's really neat. One of the things we found was that the Spanish-speaking patients are very satisfied with their care. They're like, no, nothing can be better. They're very appreciative of what the clinic does. They are glad that they get called back quickly, and because there's 2 Spanish interpreters on staff that are trained in medical Spanish, and both of them are actually from Spanish-speaking nations, they are able to have that good relationship with the interpreters, and the interpreters are well trained. So they're very happy with that. The only thing we found is with prescriptions that can be a challenge for a lot of these patients, especially those who are first generation in the United States. So their English isn't very good, and then you add in medical stuff and it gets just kind of challenging and difficult. So when medical clinics had to transfer over to using electronic medical records, they also switched over to doing electronic prescriptions. And with that, they no longer had a box they could check on the paper written prescription for the prescription labels to be printed in Spanish. So now all labels get printed in English at the pharmacies in our area. And the pharmacists are not reprinting the labels when they realize that it's a Spanish-only speaking patient. So the patient is getting these medications, and their prescription labels are in English, so they can't read them. And so they're trying to do their best by remembering what the doctor said at the office. And that's a bit of a challenge, especially when you've got a sick 2-year-old who's screaming and in a lot of pain or hurt because they have an ear infection or they have bronchitis or whatever it is, or your 6-year-old with chicken pox. So it can be a bit of a challenge. And then when the pharmacists don't necessarily have the interpretation abilities that they have at the clinic. So that was a really neat interaction. It's kind of cool to get to sit down and talk with the interpreters about what they see, because they're also around all of the patients throughout the day. While they work with the Spanish-speaking populations, they get to observe others, and how their Spanish-speaking patients, even from the physicians, will say the same thing. They're very appreciative, and that when you give them instructions in medical care for their child, they want to follow those instructions, and they truly value their family. And want their family to be well and want them to be healthy, and anything that they can do to accomplish that, they're going to. They're really good about showing up on time for their appointments. They are more soft-spoken and quiet when it's being a translated service. But when you watch them interact with the interpreters, there's very much a community, because both of the interpreters, and one that I actually got to talk to, Miss Sonia, is from Puerto Rico, and very outgoing, and just kind of engages with anyone. And to watch the interpreters interact with the patients and the patients' parents, you can tell by the tones in their voice that it's a very pleasant, enjoyable interaction. And the kids will come and crawl in your lap and just want to play, and are very open to people. They aren't, none of the kids we saw that day were very shy. They would be shy at first, and once mom or dad started talking to you, or they realized that you could say anything in Spanish to them, they were happy, and they would come and play with you. I also that day was able, in between patients, was able to work on a flyer that explains what a medical home is, and that flyer is actually going to be translated by the translators into Spanish. So making sure that what was in the flyer was not only applicable in the understanding and culture of the English-speaking population, but also for the Spanish-speaking population, and talking with the interpreters about what are some of these cultural differences and understandings and values, especially with children and the way that parents take care of their children. I also had the opportunity to put together a bulletin board for them that's going to be interactive. So it's kind of cool about being a medical home. And so what they're doing is we're putting fingerprints of the different kids and turning them into flowers or butterflies or different things. And so I got to each of the kids that day, talking with them, and especially the Spanish-speaking kids, because the interpreters helped me with enough Spanish to say, would you like to come? Or we go over here, and to say, oh, thank you, and then what I need to do with the inflection in my voice. And usually just smiling, the kids would be happy. I mean, that's one of the things that English or Spanish, it doesn't matter, kind of goes crosswise. Let's see. So, cultural similarities and differences. I know one of the differences I talked about is just in the way that the parents care for their children and listen to the instructions of the doctor, where they respect the position of the doctor and respect what the doctor says. Sometimes with the English-speaking population in the United States, parents want to think that they are medically trained, and while yes, that parent is going to care for their child more than anyone, the Hispanic population, they respect that position and respect that this person who's a doctor has been in years and years of education to take care of their child. So that was one of the big differences. Similarities, I mean, people are people. They really are. But it was neat to see they truly they cherish their children. And I think one of the biggest differences is a lot of these patients, they are first generation in the States. So they want to do anything they can to make sure that their child has a better life. And any sacrifice they can make for their child, they're going to. So it really had a neat effect on me, just being able to see that, see the way that a mom interacted with a child. Now, obviously, it's going to be a little bit different than a day-to-day interaction because you're in a medical facility, so they're already kind of in a different mindset, and a lot of times it's with a sick child. So any parent, regardless of culture or language, when your child is sick and the child's not feeling well, they're cranky, they're crying because their ear hurts, obviously the interaction is going to be a little bit different, but you saw how they really cared for the child, but encouraged, most of them would care and love and hold the child if they needed to, but also encourage the child to go and play and to go and do things and to have a little bit of independence, knowing that mom or dad was a safe zone to come right back to. So it was a really neat project. I'm glad I got to do this. It was cool to actually get to purposely interact with the Spanish interpreters rather than just seeing them in passing at the clinic. And thank you very much for this class. I've really enjoyed it. Bye.